It's just like they feel very tired, like they feel like fatigue will be there, really tired, and sometimes they even feel that breathlessness, shortness of breath. So this leads to decreased work productivity, economic losses, and even the maternal mortality. So maternal mortality is death of the mother during pregnancy or during delivery. So those are considered as maternal mortality. And during pregnancy also it's linked with some adverse birth outcomes, like so that you can see some birth defects in the child. So there is a very difficult cycle of health challenges for generations is happening because of anemia. So anemia, what is anemia exactly? So this anemia is the thing that happens when the body inadequately produces healthy red blood cells or hemoglobin. So it affects 28% of the corporate female employees. So hemoglobin is a protein that is found in the red blood cells. So this carries the oxygen from lungs to different organs of the body. There are different types of anemias you can see here. Some types of anemias are short term, mild, and they can be corrected very easily. But others last for lifetime, and if untreated, they can be life threatening also. So the very first thing is nutritional anemias. So these type of anemias occur due to vitamin B12 deficiency, iron deficiency, and also there are certain autoimmune conditions which leads to this kind of nutritional anemias. So there are inherited anemias like sickle cell anemia and also thalassemia, where the red cell structure itself get distorted. So anemias by abnormal red cell types also will be there, like hemolytic anemia. Here the breakdown of the RBC will occur, as well as these RBCs will die faster in this kind of anemia. Next one is aplastic anemia. So here what happens is the anemia causes because of the stem cells in the bone marrow have a specialized cells called stem cells. So they don't make enough of this RBC. Next is autoimmune hemolytic anemia. In this, due to the immune attack, the RBC are having short time as well as short lifespan, and they die very easily, causing to this kind of hemolytic anemia. Next comes the sideroblastic anemia. So sideroblastic also it's a morphological defect of the RBC. So here you'll find like too much iron will be there, and you will not have enough of RBCs. Macrocytic anemia, here the bone marrow makes very large cells, that is RBCs, so this causes this kind of anemia. And microcytic here also very smaller, like you'll be finding less hemoglobin here. In normocytic anemia, fewer RBC will be there and they don't have normal amount of hemoglobin. So this how these are different kinds of anemias. So what are the causes of anemia? As mentioned, poor diet causes iron deficiency anemia, which is the most common cause of anemia, especially in vegetarians as well as who consume vegan diet. And pregnancy and breastfeeding also, here the demand levels will increase and that causes the depletion in the iron levels and leading to anemia. So menstrual periods. Here also what happens, having heavy periods, prolonged periods, this can create the anemia. So other conditions like other chronic comorbid conditions are having kidney failure, diabetes, and also chronic conditions like, as mentioned, some of the autoimmune diseases, cancers, this also leads to anemia. So inherited anemias like the same thalassemia, sickle cell anemia, these also cause anemia. And drinking too much alcohol, so lifestyle things. So having alcoholic drinks like frequently, and people over the age of 65 years are also at risk of developing anemia. So what are the symptoms? The main symptoms, whenever you are having anemia, the main symptom you will be feeling is fatigue. You will feel very much tired, and it's very difficult for you to manage even the daily activities also. The other one is shortness of breath. Here, like it becomes difficult for you to, like you feel like you can't catch your breath. And also a sensation of feeling of suffocation also will be there. And fast heartbeat will be there, like your heart is racing, like kind of thing. Increased heart rate will be there. And dizziness is a feeling of lightheadedness and unsteady. You can't stand, like you'll feel that. And headaches will be there. In any kind of anemia, you'll feel that headache will be there, like continuous headache will be there. Cold hands and feet also, you feel very weak, you feel that your hands and feet are very cold. So this happens. And when coming to severe anemia symptoms, an inflamed or sore tongue will be there. The tongue will be little bit bulged, it will be inflamed. And also when we look at your skin, it will be pale in color. And your palpebral conjunctiva, the one below the eye lid, the lower eyelid, also pale in color, it will be there. So getting lightheaded when you stand up, as well as sometimes you even feel like chest pain. And pica syndrome is a desire to eat non-food items like ice, you want to have that one. So these are the severe anemia symptoms. Now coming to the diagnosis. So the only diagnostic criteria is we'll be doing complete blood count, as well as the hemoglobin percentage, as well as RBC cells in the blood, that is hematocrit, will be taken into consideration. So the normal adult values for men, it is 14 to 18 gram per DL, and for women it's 12 to 16 grams per DL. Okay. So when do we consider as anemia? When it is less than usually 11 and less than 11 is considered as normal, and something below 10 or equal to 10 is considered as anemia. So there will be demarking like severe anemia, moderate, as well as mild anemias based on the levels below 10 as well as equal to 10. So treatment, how is this going to happen? So in iron deficiency anemia, you have to replenish the iron stores through iron supplements, as well as dietary changes, like you have to consume iron rich food. And vitamin deficiency, you have to consume the folic acid, vitamin B12 in order to get the hemoglobin levels increased, in order to correct that deficiency. And anemia of chronic diseases, you have to, like, underlying diseases will be treated here. So how to prevent? So prevention is better than cure, as always said. So here, what are you going to do? Just adapt to the healthy lifestyle. Eating healthy diet might prevent this iron deficiency and vitamin deficiency anemias, especially like during the period of pregnancy, during the period of breastfeeding. Try to consume good nutritional food so that you can avoid such conditions like anemia and other nutritional deficiencies. So what are the myths that are happening? So what are the myths here? If you have iron deficiency, you are anemic, and vice versa. So here, what is the fact is, it is true that anemia can be caused by iron deficiency, but this doesn't mean that iron deficiency and anemia are always linked. Okay, so although iron deficiency is the most common cause of anemia, some other conditions like blood loss, lack of RBC production, and the previously mentioned conditions, high rates of destruction of RBC, also leads to anemia. So one more myth is like if you are vegetarian, then only you are at increased risk of iron deficiency or anemia. So even if you are not a vegetarian, if you are not consuming the diet that is rich in proper nutrients, then ultimately it's going to lead to this anemic conditions. So consuming, even in vegetarians also, consuming healthy range of beans, greens, as well as fruits, vegetables usually protect you from the danger of anemia. So assurance by NanoHealth impact, like more than 30% of the women suffering from anemia saw significant improvements in their condition through our tailored nutritional guidance as well as interventions. So vitamin B12 deficiency in working women. So here what happens? In working women, they are more prone to nutritional deficiencies, as mentioned, because of their chronic stress, as well as overtraining and untimely fat diets. Like they'll be cooking something at food and they want to consume the same because of lack of time, and they don't bother about the nutritional values of the food they are consuming. So that's how it happens. And micronutrient deficiencies pose a particular risk to women of reproductive age, pregnant women, and children. So among these, the deficiencies in vitamin B stand out, potentially causing various symptoms such as paresthesia, like tingling, numbness, as well as burning sensation in your hands as well as feet, and also in peripheral neuropathy, weaknesses of the muscles will be there, altered mental states will be there. So all this will happen. Psychosis, here the altered mental status will be there. So even the cardiovascular events like heart attack, stroke, if left untreated, it can cause to severe complications. So vitamin B12 deficiency happens when the body is either not getting enough B12 from your daily food intake, or it's not absorbing enough B12 from the food you have taken. So it is an important nutrient that helps your body to synthesize red blood cells, DNA, as well as the genetic materials in all of your cells. So it helps in maintaining the healthy nerve cells as well as blood cells. The body does not synthesize vitamin B12 on its own. It has to be consumed, vitamin B12 has to be consumed through the rich food as well as drinks. It is found in animal products such as meat, dairy, and eggs. It can also be found in foods that are like vitamins, nutrients added to them, that is fortified things, certain cereals as well as bread. So, what is the average recommended daily amount that has to be taken? In adults, it is 2.4 microgram per day. In pregnancy, it has to be pregnant and breastfeeding a little bit more, like 2.6 microgram per day, and breastfeeding is 2.8 microgram per day. So, what are the causes of this vitamin B12 deficiency? So, lack of proper diet that is rich in vitamin B12, and also there will be few conditions like gastritis where the inflammation of the stomach lining gets affected and the absorption of the vitamin B12 gets affected. So digestive diseases, here the diseases affect the digestive system. And so what happens is, here's few conditions like Crohn's disease, celiac disease. These prevent the body to fully absorb the vitamin B12. So they will be having few other conditions where the digestive system gets affected, where the digestion will not occur properly, leading to chronic diarrhea or constipation. And all these conditions also decrease the absorption of vitamin B12. As well as there are few surgeries, gastrointestinal surgeries, when done, the absorption gets affected. And the same excess alcohol intake, as well as vegetarians who doesn't take enough of the dairy products as well as eggs. And what are the symptoms of this vitamin B12 deficiency? So coming to the symptoms, you feel like same like anemia, you feel very tired and weak. But here you don't feel any hungry as usual. Weight loss will be there, and same having the sore mouth or tongue, like you will be not able to eat any spicy food. You'll feel that burning sensation. And neurological symptoms, numbness and tinglings in the hands and feet will be there. Vision, blurred vision problems will be there. Having hard time remembering things, or getting confused easily. Psychological symptoms, feeling depressed, feeling irritable, experiencing a change in the way you feel, like behave, like you'll be feeling like you'll be carrying this low moods. So diagnosis. Vitamin B12 deficiency, what happens is, the main tests are same, complete blood count and vitamin B12 levels. So normal levels of vitamin B12 in the blood are 2,200 to 911 picogram per ml. So prevention, consuming vitamin B12 through milk, dairy foods, eggs, fish, poultry, etc. has to be done. And also fortified foods like bread and cereals, plant milk also will be available in the market. Vitamin B12 supplementation is the main thing, and avoid the alcohol intake. So treatment is through cyanocobalamin oral medication, intramuscular injections. Depending on the cause, the underlying disease condition is also being treated. So, what are the myths of this vitamin B12 deficiency? Vitamin B12 can instantly boost your energy. This is a myth, because vitamin B12 can boost overall energy levels and elevate the fatigue only when the levels are below the optimal. It is in a deficiency range. That is, it is below the 200 picogram per ml. Then only you will see this kind of, or it is within the optimal level, that is below 300 picogram per ml so then you can feel this increase in the energy levels and the energy boosting. So it may not work as an energy booster vitamin if you already have enough of B12 intake or B12 in your blood. Only vegetarians are at risk of this vitamin B12 deficiency. This is a myth, because anyone can be at risk of vitamin B12 deficiency because of this modern life, diets, as well as medication changes. So there are few medications which usually suppress the absorption of this vitamin B12, like the things that you will be taking, antacids you will be taking, like proton pump inhibitors you will be taking. So this affects the absorption of vitamin B12. And also restrictive diets, some dietary things for you want to be on diet for few days, then you will decrease this kind of nutritional intakes, and it leads to deprivation. And also people above the age of 50 years. So coming to vitamin D deficiency. So this is our last condition of nutritional deficiency that we are going to discuss for the day. So vitamin D deficiency is a common global issue. 81% of the working women have vitamin D insufficiency, and 20% of them have severe vitamin D deficiency. Okay. Research has highlighted a significant correlation between vitamin D deficiency and also mental health among the working women. Especially women with insufficient levels of vitamin D are at heightened risk of experiencing depression and also reporting lower mental health related quality of life. Understanding this association usually gives importance of addressing this vitamin D levels at a comprehensive mental health care for women in their workplace. So it is an essential vitamin used for the normal bone development as well as maintenance. And vitamin D also plays an important role in the central nervous system development, muscular development, and also bone musculoskeletal, that is bones also get involved here, and immune system also. So what are the signs and symptoms of this vitamin D deficiency? So the first and foremost one in any nutritional deficiencies, you will be feeling the fatigue. And the other one is hypocalcemia. Here the decreased levels of calcium will be noted in your blood. So that will be leading to demineralization of the bones, that is weak bones, they cause to weak bones, osteomalacia like condition, and later further it can lead to bone fractures also. And also muscle weaknesses like muscle pains as well as cramps will be there, mood changes like depression will be there. And causes of this is not getting enough vitamin D in your diet is one thing, and sunlight due to indoor working lifestyle, city pollution, smog. This also blocks the UV rays from spreading time, spending time outside. Okay. So genetic factors also, it might be prevailing in your families, like your father might be having vitamin deficiency and the same might be carried to the child. So these things will be happen. And pregnancy and lactation where the demand will be more. Certain medical conditions also cause this vitamin D deficiency, like sedentary lifestyles leading to obesity, high BMI, and liver diseases. So how is the diagnosis done? Blood tests are done to see the levels of vitamin D. The normal levels are 30 to 100 nanogram per ml. So exposure to sunlight should be there to treat this, as well as vitamin D rich food, calcium rich food you have to consume, and vitamin D supplementation is must. So here is a research thing you can see here. So some effects of vitamin D in working women, especially women who sit for extended periods doing desk work, are prone to these conditions. So in the reproductive age group, that is in the early 20s, early 30s, late 20s, so vitamin D supplementation may reduce, as well as this may cause the gestational diabetes, that is diabetes during pregnancy, and also low birth weight in their babies, and preeclampsia, that is it is a condition during pregnancy. They'll be developing the blood pressure and proteinuria, protein in the urine. This condition will be prevailing. So it is a potential preventive agent for the breast cancer in young women. So vitamin D supplementation should be given for the young women in order to say this deficiency should not be there in young women, because this might lead to even the breast cancers. This deficiency might lead to breast cancer. So women aged above 40 years and perimenopausal. So women above 40 years are mostly affected by vitamin D deficiency. So vitamin D determines the patterns of postmenopausal bone loss as well as age-related osteoporosis also. So coming to postmenopausal women, here the reduced vitamin D deficiency, it leads to reduced bone density and increased risk of fractures. There will be, because of the estrogen will also decline in this age group people, and this leads to increased risk of cardiovascular diseases, diabetes, hyperlipidemia, and many other things like cancer. And there are few conditions like genitourinary syndrome of menopause. Here, especially what happens is vaginal dryness will be there, as well as vulvar atrophy, the painful, like they feel a terrible pain while sitting, walking, and even urinating. They'll have that urinary incontinence, that is the urge to urinate. And also it even, this vitamin D deficiency, it even causes the emotional symptoms also. So what are the myths? The more vitamin D you take, the better. Taking too high doses of vitamin D supplementation for too longer duration causes vitamin D toxicity. So longer duration of vitamin D intake has to be avoided. Supplementation especially. So it's easy to get vitamin D through food alone. No, that's completely false. You have to get exposed to sunlight, and also you have to take supplements. So what are the facts? Like low vitamin, as discussed, like low vitamin D even leads to bad moods also, poor mood, as well as it even vitamin D supplementation enhances the mood of the woman in type 2 diabetes. Okay. Vitamin D helps to improve your immune system. Getting enough vitamin D can improve even the blood sugar levels also. So, vitamin D deficiency causes a slight rise. There might be a slight rise in your HbA1c levels also. When supplementation is given, there are chances like the HbA1c can get down. So, adequate vitamin D is linked with a lower risk of certain cancers also. And also, age affects your skin's ability to make this vitamin D. So, vitamin D supplementation has to be taken occasionally. So this is the ending slide of our presentation, assurance by NanoHealth. So how we are engaging the working woman, how we are getting better results in the working woman, what kind of methodologies we are using. So 90% of the women employees identified at risk has been treated through our customized, so tailored solutions will be there for them. So there are like, our approach goes beyond this mere screening as well as consultation. A holistic approach will be there, like employees health journeys will be there, ensuring personalized as well as effective health interventions. So that brings us to the end of the presentation. So if anyone have any questions, I'm happy to answer.
Hi, doctor.
Hi.
I have a question here. Does iron supplements interfere with the absorption of other minerals like zinc, calcium, and magnesium?
Yes, definitely. So usually these iron supplements have a tendency of decreasing the absorption of other minerals. So usually it is advised to take at least a gap of 2 hours should be there. It is advised to take at different times in a day, this different kind of medications. Like iron, you can take 2 hours prior to your calcium tablets.
Okay. One more question I have here is if I'm feeling very tired, just with that one symptom, can I start taking my iron supplements?
See, it's generally not recommended to take any supplementation without proper blood work. So the first thing is you have to go to any diagnostic center as well as get it done. If your results are less, then your doctor is going to recommend the supplementation in a required dose. So it's better to take the dosage as recommended by the doctor.
Okay. And can I take multivitamins along with iron supplements? Is that recommended?
Yeah, definitely you can take multivitamins along with iron supplements. But the thing is like it should not exceed the recommended dose. It should be within the limits of the recommended dose.
Okay. Okay. Yeah, I think this has solved my questions. Thank you.
So anyone have any questions? So I wish that this session is beneficial for you, and here I'm going to end
Hi,
this.
doctor. I have one question.
Yeah, yeah, please.
Best time to get vitamin D, I mean, from sun exposure or supplements?
So supplementation, see, as mentioned earlier, it's a correlative effect will be there. Like you have to take proper diet as well as you have to take supplements also, and you should get
Okay.
exposed to sunlight also. So, but better time, like it depends upon your access to sunlight. If you have better access in the early mornings itself, then the better time is 6:30 to 9 a.m. And
Okay.
later, if you are living in a very high, too much of concretes around you, and you can't get access to sunlight, then you can get it like 9 a.m. to 1 p.m. also. But a minimum exposure of 15 minutes a day, so
Okay.
4 to 5 times a week are usually beneficial.
Okay. Yeah. Thank you. And one more question: how much time will it take, taking vitamin B12 supplements to show its effect?
So usually any supplementation, it requires 3 months of time to replenish inside your body. Minimum 3 months is required.
Okay.
But when you start taking this oral medication, like in 4 to 6 weeks, you can find the difference also. Like your energy levels will be increased. And I
Okay.
am sure it shows in few days, I can say.
Okay. Yeah. Thank you, doctor.
So anyone, any questions? So if no one has any questions, like I'm going to end my presentation here. Hope this was helpful for you and see you with a new topic. Thank you.